most debated subjects in thoracic surgery is stage 3A lung cancer. So as in our other videos you have noticed, lung cancer has 4 stages, 1, 2, 3, 4. And these stages have A and B subcategories. So stage 3A is a very unique stage, which means the tumor is either small or big, but it has a lymph node involvement. And this lymph node may be in the lung tissue, but in those circumstances the tumor is big, more than 5 centimeters. Or the tumor is small, like 1, 2, 3, 4 centimeters, and the lymph node is around the main airway, which we call trachea, the windpipe. So if we have such a tumor, what will we do? Well, this is actually an advanced stage. It is not an early stage lung cancer. But there is a good likelihood that we will beat this disease with appropriate treatment. So there are several types of treatment in those patients. One of the treatments is just getting no surgery. You get chemotherapy and radiation, and the tumor responds to treatment, and a certain percentage of the patients get cured of disease. Obviously, it's not an early stage lung cancer, so there's a likelihood that some of the patients will not be able to beat this disease. But in a certain subgroup, when you have only one lymph node involved around the airway, the windpipe, and you have a single tumor in the lung, then in those patients, there's a big discussion in the scientific world that we should either get them directly out with surgery, like they do in Japan, with all the lymph nodes and the tumor out, or we can give a treatment upfront, which means neoadjuvant treatment, which means treatment before surgery. So you give a treatment to the patient, the tumor gets small, the tumor and the lymph nodes get most likely cleared, and then you remove all the lymph nodes and the tumor. And you have a good chance of helping the patients in those patients. This surgery can be done minimally invasively or in an open fashion. It is not, usually most of the centers perform the surgery minimally invasively in those patients, which means you perform the surgery through small incisions instead of a big single incision. And what is the likelihood of survival? It is a tough disease, and survival is just a reflection of numbers. It doesn't mean anything for the individual patient, which means if it's a 40% survival, it doesn't mean that your 40% is alive and 60% do not survive. So for a stage 3A lung cancer, usually the survival rate with appropriate treatment is about 40%. So 2 out of 5 patients actually get cured of disease, which is a very significant thing for lung cancer. But who knows you will be that 40%? Nobody knows. So it's best to get the appropriate treatment and wait for the results. And the treatment, the surgical treatment, the best surgical treatment is doing a lobectomy and getting the lymph nodes out. We try to avoid taking out the whole lung in those patients, because taking out right or left lung in those patients result in poor pulmonary function, and also in long term the patient's survival is not as favorable as we like it. So we try to avoid pneumonectomy. So there's a role for surgery in stage 3A lung cancer, but this role has to be worked out diligently. It has to be worked out very carefully, and the appropriate treatment should be applied.